This is the traction splint. It is used on an isolated mid-shaft femur fracture, and it is supposed to, when you have a femur fracture, your bones are crossed over like this, and it creates a cavity for blood to accumulate. So the traction splint is supposed to pull your bones back into place, and your muscles will compress and control some of the bleed. So contraindications for the traction splint are injuries within 1 to 2 inches of the hip or ankle, or a knee, hip, or pelvis injury. Anything but an isolated mid-shaft femur fracture. When you open the bag, you'll see your traction splint along with these 3 straps. In this case, we have a Sager splint, which is a unipolar traction splint. And up here, you'll see we have the pad that goes in between the thighs, and it has a bendy piece, which is supposed to face downwards. It works on both legs, and in order to use it on the other leg, all you need to do is press this pin, and it pulls this off, and you can flip it around and attach it the other way, so that now the bendy piece faces downwards again. You have your ischial strap up here, which wraps around the upper thigh, and it's attached by a D-ring. So you feed the strap through both D-rings to attach it, and then back through the last D-ring, and that secures it. Down here you have the ankle strap, which is Velcro attachable. The padding goes around the back of the ankle, and you have your traction wheel, which shows how many pounds of traction you're pulling at once. To extend the traction splint, all you do is pull, and then to bring it back in, all you do is press this down, and that'll allow it to collapse again. Now I'll show how to apply the traction splint. The affected leg on our patient is going to be the left leg, and I'm going to ask my partner to begin holding traction on the left leg. Make sure that the shoes on the patient have been removed at this point. And before we apply the traction splint, we're going to assess PMS on both legs. So pulse, motor, so wiggle your toes and sensation. PMS should be intact in both lower extremities as your partner is holding traction. And your partner will not remove traction until the splint has been applied and is holding traction for us. And to apply the Sager splint, again, the bendy part of the pad should face downwards, and the wheel, the traction wheel, should face out towards the affected leg. And we're going to have the pad sit pretty high up in between the thighs. Make sure to tell your patient what you're doing. And then the strap should wrap around underneath the thighs and be secured by the D-ring. And try to get it to sit pretty high up. And that lower pad is bent towards and under the affected leg. We're going to secure the strap by the D-rings. Again, get it to sit pretty high up. And once that is secure, we're going to apply the ankle strap, which is Velcro attachable, and goes down and under the ankles first. So position it underneath the ankle and then attach it. Now that that's secured, we're going to begin pulling traction, and we're going to pull 10% of the body weight up to 15 pounds of traction. And we'll stop there. Now my partner can let go because the traction splint is holding traction. And we are going to secure the splint to the legs with these bigger straps. So one of the straps should go underneath the lower leg, securing the lower leg to the splint. Try not to manipulate the legs too much while you do this. This one should go at the upper thigh. So under the leg and around the upper thigh, securing the splint. And then this last longest strap should go around both legs so that you secure the unaffected leg to the affected leg in the splint. So we're going to go underneath both legs. Can bring the unaffected leg a little bit closer to the affected leg. And we'll secure them like that. Now that the Sager splint has been applied and the straps are applied, we're going to again assess PMS, wiggle your toes, and then can you feel this? And PMS should be intact in both lower extremities. That is how you apply the traction splint.